My name is Manish and one of the aspirant in this skill. So my registration number is V020. Today for listening test, we have some 5 aspirants teaching us, making us understand in listening part A.
Good evening, friends. My name is Manju Shibu. First of all, I would like to say my sincere thanks to Father giving me this wonderful opportunity because when we are learning OET, getting chance to share our learning experience is very useful. So I request all of the participants to come forward and take discussion one day and share your learning experience. Maybe so many mistakes will be there, but don't worry about that. No one will judge you. Okay. Then I will do the introduction part. First of all, in our OET exam, there will be 4 chapters will be there. First module is listening module, then reading, then writing, and following that speaking test will be there. In the listening part, there is 3 part will be there: A part, B part, and C part. A part we will get 2 consultation. There will be each consultation we will get 12 question. Conversation will be there. In that conversation, maybe health person will talking to the patient. Maybe there will be a neurologist or cardiologist or physiotherapist talking to the patient. When we are getting booklet, that time we will get 30 seconds. That time we have to read all the instruction. That time we use it properly and get idea. There they mention what professional is talking to the patient. We'll get idea. He is a physiotherapist. Maybe the patient is came for some difficulties walking, or he is taking any therapies from him. So we'll get idea. We can predict what is going to the next. Then they explain the patient name and all read it. Then if you are seeing any subheading, underline, and each line you read fast. Then reading the questions and we are hearing the audio, what we are hearing, that same word we have to write it in the questions. Because we are a medical profession, we know so many abbreviation or so many medical conditions, but do not paraphrasing, but what you are exactly hearing, that same word you have to write it as an answer. Then one more thing, maybe that patient is telling specific right leg or knees, then that also very important. If you are writing instead of singular, we written as a plural, the answer will be wrong. Okay, then father always told us to we have to aim grade A. When we are aiming for the grade A, so surely I can assure that we will get B grade. When we are thinking only I want to B grade, our mindset also like that. Okay, I need only B grade. We are thinking like that. I'm aiming for B grade. Most of time, people stuck with 330 or 340. Because of that, we have to aim for grade A. Then surely we will. Our mind also will work hard for that. Then we will get at least B grade. That's enough for our desired score. Okay, I already told that to consultation, that is between health professional and patient, and listening for specific details. When we are hearing the audio, that time we give more important to the what patient is talking, because most of the time question will be that patient what is saying according to that. So give more important for that patient's conversation. Then complete the notes or sentence using a word or short phrase. What we heard in the audio, that same word we have to write it. Then listening in that, read the instruction given the question booklet, use the word exactly what we heard in the audio, and do not paraphrase or change the word forms. Context also very important. That time when we are reading, that time we have to look in who is the patient name, and what is the health person designation. That also very important. Then listening strategies. First thing is prediction. When we are reading the booklet and when we are hearing the audio also, before that we can set our mind and we can predict some answer. So the conversation is going between cardiologist or patient or physiotherapist, then we will get idea relating this that audio is coming, so we can predict the answer. Next one, be aware of paraphrasing. Maybe in the booklet is written some patient is telling some other way, we have to understand. Be aware of synonyms. Synonym is very important. Then for reading and listening, what are things we are in the reading module or listening mode, we are going through the synonyms. We have to make it a diary for paraphrasing and synonyms. That is must. Be aware of collective words also important. Then when we are hearing the audio, what all thing we should listen. First one, body parts. We give more important for body parts. They are telling patients having chest pain or abdomen pain or body parts they mention, then we listen properly. Then adjective. Then patient is telling having a severe headache or he lifted heavy suitcase. Then heavy or severe, that is adjectives. Next one is name, medical condition or medicine. When we are hearing any medical condition or medicine's name in the audio, that time we especially notice that. Or when we are learning new material, that time we are getting any medicine name, new medicine name. If we don't know spelling, then that you have to write it and learn, because medicine name and medical condition, sometimes this will repeatedly will come same thing. So it's better when you are learning the new materials, or if you don't know, then write it and practice. Symptoms, same way, telling any chest pain or headache or symptoms also we give more important. Negative expression means telling do not unable to walk or do not get, or we have to notice that. Sequence means when we are hearing lastly, finally, firstly, after that maybe we will get some answers. Cause and effect. Sometimes patient have earlier some difficulties, or patient used any therapies or any medicine patient used. Maybe after that patient had any problem occurred. That also very important. Procedure like X-ray or any USD abdomen. That all we look into that. Next one, daily activities. Sometimes patient is telling, I am unable to walk. Maybe we will heard about only able to walk. So these are very important. Presumption, that also is very important. Okay, that's all. Thank you, friends. Thank
Thank you,
you.
Manjuna, for
Thank you.
making us understand about how does the listening part A work. So next, Nitus Francis, who is going to discuss question number 1 to 3.
Good evening, everyone. My name is Neetu. I am one of the OET aspirants from Edu Skills International. First of all, I would like to thank you, Father Khalid Joseph, and all the admin to give the opportunity to share my learning experience in this platform. Today, I am presenting listening part A question number 1 to 3. So first, we will get 30 seconds to read 12 questions before the audio begins. So that time we need to predict or anticipate or foresee. This is the first method. Then it is important that we need to write the exact word or phrase in the audio. Then, firstly, we need to identify who is speaking. So, in this listening, the optometrist is speaking. So, optometrist is speaking to the vision. So, we can predict this in our mind. Then, who is he speaking with? So, the optometrist is speaking with the patient. So, the patient name is Aiden Frizpatrick. Then, the next is we need to focus the subheading. Here, the subheading is symptoms. So, here we can predict if the patient comes to the hospital with the problem of eyesight. So the patient may get the symptoms like blurred vision. Sometimes the patient struggle with the reading. Then patient may get more light. Then sometimes patient read closely. So these symptoms we can predict in our mind. Then the first question is describe his vision as dash. So the keyword is describe his vision as. Whenever we get described, here is it is something compared to another thing. Then this is patient feeling. The next is needs increasingly dash to read in evening. So here we can predict patient may need more light. Then third one is purchase glasses from dash. So here we can predict purchase glasses from any place or any shop or maybe pharmacy. Then next we can go the transcript. Here, patient has been experiencing blurred vision. So the blurred vision is the topic. Then what has been going on with your vision? So here, this noted that the patient is experiencing symptoms or issues. Here, it kind of felt like everything was fuzzy around the edges. Here, the answer is fuzzy. The feelings and emotions will be always the answer. Fuzzy means it is not clear. Then next, she mentioned that I had been using increasingly more light to read at night. Here the answer is more light. Increasingly is an adjective. Then the more light is came. Then I went out and got some of the glasses they sell at the pharmacy. Here the answer is pharmacy. Thank you.
Thank you, Nitish Francis, for very good explanation. So we have come to know that what to look for and how to make us understand about the reading the question and how to predict our answer by reading the questions. I would like to call Savita ma'am, who is going to discuss the question number from 4 to 6.
First, I would like to thank you, our mentor, Father Salim Joseph, and all the admins for giving me an opportunity to learn from this beautiful platform. My question is here. Yeah, here often finds that he is dash in the eyes when even when wearing glasses. Often we can, from prediction, we can predict that from the order, predict for the synonym words of frequently, like that. And here patient is not talking about herself or himself. He are talking about he's someone. He is someone. So his eyes even when wearing a glasses. So he having some symptoms. Yeah, we can predict the any symptoms. Okay. After that, question number 5. When struggling to see, can also experience. Along with this, experience can also means along with one symptoms, there are all experience are feeling some symptoms. So we can predict that. And then Aiden treats pain with a dash, fast acting. In bracket, they are giving a hint of fast acting. Before this, we can also see that they are talking about the treatment plan. So we can predict that we can the answer must be any medicine. Okay. So here they are telling about some symptoms. So we can expect that in audio they are saying often frequently he is squinting his eyes, even he is wearing the glasses. The answer is squinting. When struggling to see, also experience a persistent headache is given in the audio, but that is also right when we are going to write a persistent headache, or if we are writing headache also is a right answer. And when we come to the treatment plan, the ibuprofen is an answer. It is fast acting as they are giving the hint. Thank you.
Yes, thank you, Savita ma'am, for providing us very good explanation on listening from question number 4 to 6. Here, I would like to call who is going to discuss questions from 7 to 9.
Okay, seventh question. Here they are already given background details. When we are here, when we are reading the question, already we can underline subheading background details. Next is medical history. The background details they already telling wore glass as a child. Brother also wearing glasses possibly. Then we can predict maybe that patient is going to tell some disease or some condition. So answer is short sight. Question 8 and 9. 8 and 9 coming under the medical history. That there all the question is telling like that. Recently suffered from dash treated with antibiotic still. So we can, when we are reading the answer question, that time also we can predict maybe there will some condition name will come. So we can predict the answer related that situation. We can predict the answers. So answer is sinusitis. Then next one is experiencing symptoms of dash. Here also patient is going to tell any symptoms. So answer is a cold. So continue, Rini, please. Thank you.
Hi, good evening. I would like to say the thanks to Father Salim and all the admin staffs to help me to study and giving me an opportunity to teach a section. Okay, let's move on to the topic. Today, we are going to discuss about the 10th question is mentioned that the medical history. Medical history, when we are hearing the listening part, we're supposed to listen to the patient side, what all the symptoms suppose they have to explain, especially the conditions or the disease conditions happened before. It's not the present one, the past one. It's clearly mentioned that lost excess weight following a dash, and also the bracket is mentioned that describes as a wake up call following a dash. That means A. A means is an article. That means particularly only one disease condition and described as a wake up call. That means maybe it's a sign and symptom, either one, either a sign or either the sign, symptom, or any of the particular disease condition, but it's not collective one, only one. That's why the following A is mentioned A. A means an article, and also maybe the disease condition it is not starts with the vowel form. And it is clearly mentioned that the wake up call in the transcripts already mentioned that a bit of a wake up call some years back. That means the medical history. It's happened. A wake up call is mentioned like synonym of a medical history, and we need to be focused on the listening part either before or after. So when the medical history starts, we need to be focused on the particular disease condition or the any signs and symptoms the patient is explaining to the doctor. And a bit of a wake up call some years back, I have what you have guys called as a myocardial infarction. It was pretty scary, and I was quite overweight at the same time and really stressed out about my job. Since then, I have made a real effort to look after myself properly. I'm glad to hear it. So, here the hint is given lows excess weight following a dash. In during that conversation, only one disease condition has mentioned, like a myocardial infarction. So we can focus on to the myocardial infarction because we already got the hint like a wake up call. Come to the next one. The next step is it not willing to wear dash. Willing to wear dash means is a negative expression. In the transcriptions or in the transcript already mentioned that two things. That one is wearing glasses and wearing contact lenses. Sometimes we may get confusion. So particularly we need to be monitored, but particularly we need to be focused on which one is accurate in this portion. So, well, in the transcript is mentioned that, well, I don't particularly like an idea of wearing the glasses. Idea means in his thoughts doesn't have the glasses is not an option for him. Okay, so we can eliminate that. Come to the second part. The contact lenses are definitely not an option. I guess it's the best thing might be to just might be. Might be is showing the possibility. So we can choose the contact lenses as an answer. So is not willing to wear the contact lenses. Then come to the 12, must be given dash. Then is a hint already given in the bracket, never had done. Never had done means it is not at all done. That is also we can consider as a negative expression. And must be given. Must give. Come to the transcription is already mentioned that I have actually never had an eye test. So I should probably schedule one of those as a next step. I think that sounds reasonable. And let's do some tests to check out your eyes and then go from there. That means it's never done before and must be given. So that's these two possibility. Must be given is need to, must be, and never done before. That means there is no alternative option he had before. Means like he never underwent through. Here the only the particular thing is mentioned is the testers. Two things mentioned, the eye test also mentioned, some test is also mentioned. Maybe we will get the confusion. So we need to be focused because the eye test never done. So we can correctly choose eye test.
Okay, thank you, Rinsi, for very good explanations.
Thank you so much, sir.
Thank you very much for all the aspirants of the Edu Skill platform for very good explanation and making us understand how does the listening subtest work. So thank you for your precious time which you have provided for us, and thank you our mentor, Reverend Dr. Fadam Salim Joseph. Thank you very much for all your efforts that you are putting on us. Thank you very much once again.